me. Don't you forget about me. Will you stand above me? Look my way.
Nathan's son Gaurav has noticed odd behavior presented by his father. He is worried because he has been forgetting recently learned information and important dates. Gaurav is taking his father Nathan to his physician Dr. Fontaine for a checkup to see if his father is okay.
Go. Hey.
Hello, gentlemen. How can I help you?
Oh, we're here for a 4 o'clock appointment.
Alright, I'm just gonna have to see some ID and some insurance, please.
Okay. Here you go.
Thank you. Okay. Here you go. Just fill out this paperwork and I'll call you in shortly.
Okay. Go, go.
Nathan and Gaurav?
Here, we're coming.
So what brings you guys in today?
Well, my son believes I've been having abnormal behavior issues.
Yes, my father has been forgetting many important things, such as brushing his teeth and his birthday. He's also been misplacing his car keys. I'm worried about him.
Okay, so we're just going to do a brief examination before the doctor comes.
Good.
Okay, so first thing I'm going to do is I'm going to check your heartbeat. Okay, deep breath. Deep breath. Okay. And then I'm going to check your blood pressure.
No, thank you.
Okay. Now I need to take your temperature real quick. Okay, so now I'm going to take your height. Okay, 6 feet. Okay. You can sit down. Okay, the doctor will be in shortly.
Thank you, pretty little lady.
You don't say that to the nurse. Hey, Dad. So,
Hi guys, it's a pleasure to see you. So what's the visit about today? I see Nurse Alexandra mentioned that you've been having unusual behaviors.
I've noticed very unusual behaviors in my father. He's frustrated.
Okay, Nathan, have you noticed any changes in yourself lately?
Well, I think I'm fine.
I see. Well, I think I have an idea what might be wrong, but first we're going to run some standardized tests. Okay, now so we're going to do some standardized tests, the reflex, and just test your eyes. Good. Let me take a look into your eyes. Good. Okay, so everything seems okay, but we're going to have Nurse Allie come in to draw some blood and have an MRI and do some hearing tests as well. Okay.
Okay, so we're going to test your vision really quickly. Okay, so I'm going to need you to cover your right eye. And then I'm going to need you to read me the letter of the first line.
F,
Okay, and then the second line.
B, C,
Okay, now I'm going to need you to read the third line.
P, T, E, O,
And the fourth.
B, Z, F, E, D.
Okay, now we're going to test your other eye. Okay, now again the first line.
F,
Second.
B, C,
Third.
P, T, E, O,
And fourth.
B, Z, F, E, D.
Okay, can you try reading the little letters on the fifth line?
C, F, L, C, T, B.
And try with the next line.
T, E, P, O, I, F, D, Z.
Okay. Your vision seems
Good.
Okay.
Yeah.
Okay, so you can take those out. Okay, so now we're going to take your blood test and an MRI in the lab downstairs. So if you could follow me. Okay, so now I'm just going to test your blood for any possible diseases, anything wrong. So just lay out your arm on the table. Okay. Okay. So now our lab technician will take you down to the MRI and we're going to scan your brain for any possible, like, anything wrong with your brain at all, okay?
Let's go.
In this MRI, we're just going to test to see if you have any brain damage.
Get me out of here. I'm claustrophobic.
Don't worry, sir. It'll only take a couple minutes.
Okay guys, so we set up the tests and we're going to get your results in a couple of days and when we do, we'll give you a call, okay? And do you guys have any questions?
No.
None? Okay, so you'll be getting called in a couple of days from the doctor. That's
Okay.
Thank you.
Bye.
Bye.
After the blood is drawn, Dr. Rana, the lab technologist, studies the blood and MRI results and rules out all possible diseases that could be seen through the blood. After consulting Dr. Fontaine about the results, they both decide to go forward with more tests before they conclude a diagnosis.
Hello.
Well, hello, Dr. Fontaine. The blood test is normal and the MRI scan is normal.
Okay, I think I know what this means. I'm going to run some additional tests on the patient and come to a conclusion.
Okay.
A couple of days later, Gaurav receives a phone call from Dr. Fontaine's office about the blood results. The receptionist said the results came out negative for any possible diseases that could be detected through the MRI or blood test. Dr. Fontaine would still like to see Nathan again to perform a standardized neuropsychological test to see if behavior is still persisting. It tests for details about mental function compared to others at the same level and age as him. Also, Dr. Fontaine wants for Gaurav to watch closely at Nathan's actions until his appointment.
My keys! My keys are missing. Where are my keys? I hear jingling, but I can't find my keys.
Pops! Your
Yes,
keys
sir.
are in your back pocket.
Oh, thank you, my son.
Hey,
Where are the corn dogs? Where are the corn dogs? Where are the corn dogs? Son, where are the corn dogs?
Father! They're in the freezer! Here!
Thank you.
You're welcome. How do I
2 weeks later, Nathan and Gaurav are back at Dr. Fontaine's office hoping to find out the cause of this off behavior.
Hello guys, happy to see you again.
Hello.
Who is this guy?
Don't worry about it.
Alright, just gonna have to see some identification and your insurance card, please.
Okay. You go.
Thank you.
I think I might have left my wallet at home.
Did you check your back pockets?
Yes.
Did you check your front pockets?
Oh.
Thank you. Alright, everything checks out. Doctor will see you shortly.
Okay.
Did I ever get my card back?
Nathan and Rob?
Yeah.
Okay, so have a seat. And the doctor will be right in.
Hello, guys.
Hello.
It's good to see you guys are back. We're going to do some brief testing today, just some simple questions.
Oh, okay, I'm ready.
Okay, first question is, what time is it?
1 o'clock.
Okay, what is the date?
April 13, 1958.
Okay, and repeat these words back to me. Cat, fence, car.
Wait, say it again, please.
Cat, fence, car.
I seem to not remember.
Well, thank you. From the previous testing, it's safe to say I believe that Nathan might have Alzheimer's disease. According to the blood test, they were all negative for possible diseases. Nathan's neurological testing was normal as well. Nathan's MRI showed no possible signs of any strokes, traumas, or tumors that might cause your cognitive change in behavior. After conducting the short quiz, it seems that all of Nathan's symptoms point at Alzheimer's disease.
I do not have Alzheimer's.
The disease is quite common as well. It's the most common cause of dementia and the sixth leading cause of death in the U.S. It is almost always present in older individuals. Considering Nathan's 82, this puts him at a higher risk of the disease.
How did my father get such a disease?
Alzheimer's is not a normal part of the aging process, but the risk of it increases after age 65. It's caused by genetics, so you can't contract the disease, but it does progress with age. There also is no proven way to prevent this. The only helpful piece of evidence we found is that you need to reduce your risk of heart disease and keep an active mental state.
And there are no specific tests for this disease?
I'm afraid there's no specific test to the disease, but I have been able to determine from all the symptoms are caused because of this disease, which is a form of dementia that your father has.
Is there any treatment for this?
There is no known cure for the disease, but the goal is to manage symptoms. Luckily, your father's disease seems to be early and does not have an extensive medical history, but we can manage the symptoms by putting him on mementine, which will slow the progression of the symptoms for him.
Okay. Is there anything I can do to help with this disease?
There are plenty of things you can do to help with his disease. You need to create a safe and supportive environment that can help Nathan function normally. You can install handrails and reduce the amount of mirrors in the household. He may also forget to eat, so it's important to offer food and drinks so he does not become dehydrated.
Wow. That's a lot of information for Alzheimer's.
Yeah, there's a lot to remember about the disease, but I'm always here for questions and help. There are also fine nursing homes for patients with Alzheimer's disease when the disease starts to progress. It can get quite demanding taking care of someone with Alzheimer's. We will have frequent appointments and visits to keep up with any possible progression of your father's disease. The average patient can live up to 20 years, so don't be discouraged. I made you an Alzheimer's checklist for medical appointments to bring. It covers medication, nutrition, hearing, vision, sleep, safety, challenging behavior, and planning. It's up to you to keep up with this of Nathan's symptoms, and it's important that you check it off.
Thank you for your help into finding out what has been wrong with my father. What should I do about him since he does not know that he has the disease?
I don't.
Like I told you, just watch over him and help him feel comfortable for him to live a normal life.
Great, thank you. I will schedule an appointment.
Yeah, I would like to see you guys back in about 3 weeks, unless you start to see some more severe changes in him. I'll write Nathan a prescription. He should start using the mementine, and in the meantime, to help with the cognitive changes. I hope to see you guys during your next appointment. Just write the prescription. Just bring this to your local pharmacy.
Thank you.
Thank you. Gaurav and Nathan leave the doctor's appointment. Gaurav tries to explain to his father why he has been forgetting things, but he does not want to follow. They go back for frequent doctor's appointments for the next 5 years until Nathan has finally passed away at age 87 of Alzheimer's.
Oh, Father. Doctor, nurse, come quick, he's dying.
Oh no, he's coding. Doctor!
Clear! Take 2, clear! Third time, clear! Time of death, 5:16.
Oh, Father. My father.
I'm sorry, girl. Nathan died from pneumonia. This was caused by difficulty swallowing. Nathan inhaled his food into his airways into the lungs. Unfortunately, Nathan's Alzheimer's progressed quickly.